Todd Houghton here from Houghton Physical Therapy, excited to talk to you tonight about why you need to take your youth's or children's sports injury seriously. Excited to be here with you again for another episode of Ask the Physical Therapist. For those of you who have watched before, welcome back. For those of you who haven't watched before, my outcome and my purpose is to share as much knowledge as I can with the public and the viewers like you watching tonight, to add as much value as I can to help out with any questions you may have in the field of physical therapy. So again, my topics is why do you need to take youth and your children's sports injuries seriously? So just a few facts. What is the incidence of injury? Well, 40% of all youth injuries are sports related. That's a pretty high number, and that goes for children, teenagers, and adolescents. It's a pretty high number. How's it going, Deb? Thanks for joining. Male and female injuries are now coming to be equal due to a gradually increasing female participation, which is fantastic. Injuries are broken up into, we're going to go basically two types of trauma. The first type of trauma is the macro, which is this single traumatic event, i.e. a fracture, a fall, something traumatic that happens. These are most often, through my research, are predictable and also preventable. What do I mean by that? Most of the athletes that do get hurt, even with a traumatic event, whether it's an ACL tear or a break, we're going to look back and see that they either didn't have the right core conditioning, they were doing the right exercise. The second thing would be doing the right exercises, but not at the right time, or just the wrong starting point. The other type of injury is what's called a micro, which is a repetitive or overuse traumatic injury, overuse trauma. This, to me, is the most serious because it's chronic over time, can lead to more stress fractures, which are not a good thing. Also, these are very predictable and also preventable, and it all really relates back to working the core, working from your neck muscles to your abdominal muscles to your low back muscles. And I'm also going to let you know that injuries in young athletes are often taken lightly. Usually they're asked or encouraged to toughen up or play through the pain. Just not really a good idea at all. It is not in the best interest for this to happen for the following reasons. It can often lead to both delayed injury healing and also delayed return to sports, which I know if I don't get to exercise, it drives me crazy, and I'm probably not the best person to be around. The second thing is when we can take an easily treatable injury into one that becomes very difficult to treat. The third is this can result in serious permanent injury that will definitely preclude future sports participation or cut them out of it altogether. Again, not a good idea. So how do we prevent this? Well, the first thing is, you've heard me say before, we need a starting point. We want to get an accurate diagnosis, which is going to be essential to getting the best treatment for this. So of course we can go see your physician, a pediatrician, or obviously I'm a physical therapist. So a physical therapist can definitely make an accurate judgment just by listening to your child's history and performing a thorough clinical evaluation. The adolescents, their age, male or female, or the level of participation is also important into finding out what is the injury. A description of how their injury occurred is valuable. Your physical therapist will want to know if there was a pop, if there was swelling, if there's a history of previous injury, history of other injuries in the past, a locking, giving way if it's a knee, or just any symptoms that we can use to help diagnose the issue that we have going on. They'll also ask you how much training. I really find that I'm finding more as I get older and I continue to be a multi-sport athlete is that my body needs more rest. Rest is something, even at a younger age, it's a great idea to get into developing that rest period at an early age so it just becomes part of the normal routine. This overtraining is also going to be able to detect, we can detect whether someone's overtraining if they have a predisposing injury that they've had in the past that keeps on coming up, or some of the common sprains or strains that happen over time to the same person. I also believe that any upper body injury, shoulders, arms, wrist, or elbow, are related to the neck. And I also believe that any lower body injury is going to be related to the low back. So any hip, knee, or ankle injury is also going to be related to the low back. The next thing would be, after you go to a physical therapist, they might suggest, how's it going, Ron? Nice to see you. The next thing would be diagnostic testing. It's, in my opinion, unless there's a traumatic injury, it's rarely needed. We don't really need an X-ray or an MRI. When someone comes to a physical therapist, we're going to evaluate pretty much the whole body and how the body functions, and then we can kind of make the call if we need to send them out to a specialist. An X-ray, MRI, and ultrasound scans, again, may be required in some extreme cases, but they do cost a lot of money. And as long as we get a good history, short of having a fracture, the X-ray, the MRI is not really going to change what I do for treatment as a physical therapist. Diagnostic testing is a piece to the puzzle. I had a patient come in the other day that had a labral tear in his shoulder. I investigated and worked on his neck, worked a little bit on his upper back. He was able to come and do some throwing mechanics without having any issues, and he's been pain-free for essentially almost 2 weeks right now with a labral tear. So just because you do have a positive diagnostic test doesn't mean you're going to have those symptoms, and it doesn't mean you're going to have them for a long time. The next thing would be overuse injuries. Most overuse injuries, stressors, stretch fractures, and different types of tendonitis, tendinosis are preventable. If your child suffers from an overuse injury, the first choice of treatment is rest until a medical opinion can be sought. I agree that rest is a big piece of it. I would say motion is lotion, but definitely not to get back to the sport until we can get a really good thorough assessment. Motion is lotion, keep moving, whatever that is, whether it's walking, swimming, biking, hiking, whatever you can do to keep moving, spin class, because it is important to keep the body firing the best that we can without losing too much of your muscle tone or without losing too much of your endurance or strength that you've been working so hard to get. In young athletes, we would probably, like I said, we want to avoid the activity that is causing the problem, or at least reduce the intensity until the discomfort resolves. But again, we want to keep them as active as we can. And bed rest or mobilization is barely needed. So what can parents do? This is the big piece of my talk tonight. Parents have a significant influence on how the child can recover from an injury. So basically, I see 4 types of parents that come in. 1, 2, 3, 4. The first type of parent is the one that feels bad. Little Jimmy or little Mary really wants to play in the soccer game this weekend. They're kind of sore, so I think I'm going to let them. Well, it feels like the parent has kind of lost control and really can't have the kid stop or not, whether they feel bad or not, or whatever the reason is. But this person usually has a poor outcome because they're not really going to do what they need to do. The second type of parent is, I really want my kid to play no matter what. Let's work him through it. He's fine or she's fine. This is really not good, as you can imagine. And the patient doesn't usually do as well because they don't have the right information from the parent or the right role model from the parent. So that's a big one. Then we have the third one, is the parent that just never shows up. This is when the kids are usually a little bit older, or they just drop off the kid and go run a couple errands. I realize everybody is busy, but it's really important to be involved with your child to make sure that they can recover and make sure that they get all the correct exercises from the physical therapist, make sure they're implementing them at home, and make sure that they're really giving good feedback. I find that the parents that usually kind of drop off their kids don't really have a good rapport with the parent, with the child, and the child doesn't really communicate either, so it does kind of trickle down. So stay involved with your kids, super important. But even with the parent that never shows up, we have two kind of kids that come out of that. One that follows my advice because he or she wants the information, they really want to get better, or the one that doesn't follow my advice because they see, maybe they just don't see my information as being valuable. And the fourth one, my favorite one, as you can imagine, is the involved parent. The parent who really gets involved with a child, that really understands where I'm coming from to show them the right information, gets how it's important to ramp up at the right speed, and to be cautious on letting your kid go back to sport, especially at a young age, because we don't want them to injure themselves even more. This person, child, family usually has a great outcome. Another thing we really want to pay attention to is managing your child's exercise load. It's super important. A lot of our gifted athletes are often the victims of overtraining or competing for many different reasons. The natural athleticism of this athlete encouraged the school or student or club or representative or coach to overplay and overtrain these kids, just run them into the ground. These are the kids that usually play year-round. This may be the same sport. Some kids play baseball year-round. Some kids play soccer year-round, which isn't usually the best idea because the body is doing the same repetitive thing and never really getting the rest. These kids are also usually the ones that start on the team, and everyone wants to play them all the time. Just not really a good idea. So this is when you, as a parent, has to convey that the volume of the training and the game time to the coaches is really important to you, and you want your child to be healthy. The good coaches really get a good understanding of this and understand that overloading is a problem that really can be managed.